decision making is very important in clinical trials, and we all know that the most important thing is engage and involve the patients in all the process of decision making. In clinical trials, is particularly difficult in the different phases, phase 1, phase 2, and phase 3, because there are so many questions that the patients do not understand immediately, like they don't understand what type of choices they have to do and the implication of some choices. So the most important thing for an oncologist is be sure that all the patients we have in front of us really understand the issues and have the right frame and the right mindset to be engaged in these clinical trials. If the patients do not understand exactly the implications of our trials, they will leave the trial. So it's so important to focus on the right communication between patients and doctor. The decision-making processes are very much influenced by bias and heuristics, so that, for example, all the patients refer themselves to previously knowledge and experience. So, for example, the regret of something that was wrong in other therapies, and tend to do choices considering what they lived before and not exactly what is the issues from now and further. So one point is work on these biases and heuristics so that our patients will have the right mindset. Every patient in these new clinical trials, we can help patients in these new clinical trials just using some little helps, decision aids that are built to structure the right mindset and the right frame for our patients. There are many things that we can use to choose and to do the correct process of decision making, and give to our patients the opportunity to do the best choice. But we all know is in a certain sense the second best choice, because the best would be not to be involved in a therapy, but the second best choice will be what the one that will take in consideration the quality of life of the patients, all the issues on the future for our patients, and just be careful of leaving heuristics and biases out of this decision-making process.